Okay, good morning and welcome to our monthly webinar series. My name is Maimouna Hussain and I'm a member of the QED team. The Al-Kazaz Foundation for Education and Development is a nonprofit organization that runs out of the Toronto area. We look to run innovative needs-based education and development programs serving disadvantaged communities. And we look at creative educational technology in terms of how to fill gaps and address resource shortages to work to increase accessibility of resources to vulnerable communities, such as refugees who arrive from war-torn countries with mental and physical trauma, or who are lacking in educational or language skills. We try to work collaboratively with service providers, other researchers in the community, organizations. And this is one of our projects, which is a monthly webinar series where we invite experts to cultivate communities in support of QED's programming and founding values. And we're particularly interested in work related to mental health as it affects newcomers. And one of the projects we run is the Women's Wellness Program. It's a customized and accessible program for Arabic-speaking refugee women in Canada. The goal is to enhance newcomer well-being, dignity, and social connections, and to better meet the unique needs of vulnerable clients and communities. The program is made of 4 components: the mental wellness first aid kit, tips for healthy living, therapeutic recreation, and women's expression circle. So this morning, we're very excited to welcome Dr. Farah Islam. She'll be presenting to us on mental health concerns and service access barriers for Bangladeshi newcomer and immigrant populations living in East Danforth. So Dr. Farah Islam is a research consultant with the Access Alliance Multicultural Community and Health Services. She completed her postdoctoral fellowship in the social etiology of mental illness program at the Center for Addiction and Mental Health and the University of Toronto, where she completed her PhD. She completed her PhD at the York University. My apologies. She's a current a research consultant, as I had mentioned, and she's also editing a book on child and youth psychiatry as a course instructor for the Muslim Youth Mental Health course at the Islamic Institute of Toronto. Is also a screenwriter for the Muslim children's TV puppet show Adam's World. She looks to explore mental health service access in Canada's racialized and immigrant populations using both quantitative epidemiology and mixed media methods. She orients her research and community work around breaking down barriers of mental health and stigma. So we welcome you, Dr. Islam. Just a little bit about the format this morning. So I will pass it over to Dr. Islam, who will be speaking. If you have any questions through the course of her presentation, for those of you who are joining us live, please feel free to send them through to the YouTube chat. Once Dr. Islam has completed her presentation, we will be doing a Q&A period. Thank you, and I will pass it over to her.
Jazakallah khairan, Sister Maimouna. I'm really excited to be presenting this today. I'm just going to be sharing my screen, inshallah, so you can see the slides. So, alhamdulillah, today we're going to be discussing a little bit about some of the findings from my postdoctoral project. Sorry, one of my projects during my PhD at York University, where I did a project with the Bangladeshi newcomer and immigrant population living in the East Danforth area, which is just around the Victoria Victoria Park subway station. And this was a mixed methods project, and I'm really excited to be sharing some of the findings with you today. And if you have any questions, please do feel free to add them on the chat, and inshallah, I'll try to address them as best as I can. And jazakallah khairan to QED and to everyone who's been such a wonderful support. I really appreciate the opportunity to be presenting this today. So I want to start out by giving a little bit of just an executive summary, just so you know what I'm going to be talking about and you're aware of what this is all about. So what was interesting, one of the findings was that for Bangladeshi newcomer and immigrant populations, it was really interesting to see that when I asked them about, what is mental health? What is mental illness? How would you describe it? What are your conceptions of mental illness? They had a very holistic view of what that meant. So it was very interesting to see that, they talked about it from a very social determinants of health concept or a viewpoint. So I found that a very interesting finding. Also, the majority of participants, unfortunately, they talked about how they didn't have knowledge of the available mental health resources that were available to them in their community or in their neighborhood. And then they also talked about, when I asked them about what was sort of their greatest mental health stressor or what was causing them sort of the greatest difficulty in their life, it really was those challenges with economic integration, particularly that were involved with the stressors of migration and resettlement and how difficult it is for newcomers once they arrive in Canada. Moving on as well, it seemed, when I kind of looked at all the factors all together, it seemed that the overarching factor that seemed to be related to all of the barriers and promoters that the community was talking about, it really seemed to be that relative cultural and social isolation of the Bangladeshi immigrant community that really seemed to be the biggest barrier when it came to seeking mental health services. And so altogether, I kind of tried to take what the participants talked about into a sort of a nice action oriented strategy. So, beyond, of course, we can talk forever about all the barriers or all the difficulties that we face when it comes to mental health services, but we need to be able to do something about it. So I tried to develop a strategy based on their recommendations. So to provide a little bit of background, it's estimated that there are over 100,000 Bangladeshis currently residing in Canada, and it's probably a much higher number than that. And just to orient ourselves geographically, of course, Bangladesh is a small alluvial delta right beside India. And we have a large population of Bangladeshis living in Toronto as well. And which is why I specifically chose what is considered Little Bangladesh, or the East Danforth area, where the highest concentration of Bangladeshis in Toronto reside in that neighborhood. So that's what I chose for my project. And just to talk a little bit about South Asian mental health in Canada, just because most of our research is sort of on South Asian populations, as they are one of the largest racialized populations in Canada, and a growing population as well. It's reported that South Asian populations underutilize mental health services. They also face a lot of barriers when it comes to seeking treatment, and when they are able to seek care, they report unmet mental health care need. So there's clearly gaps and things that we need to do within mental health services to really address those concerns. So to move to the project that I did during my PhD, this was the poster. What participants said, some of the feedback that I got, was what was particularly eye-catching for them, or what made it interesting for them to participate was the fact that there was Bengali writing on it. Right at the top, you can see that. And so for many people in the community, they felt, oh, okay, this project or this research project, this opportunity is directed towards me, and that's what made them read it. So for the quantitative phase, we had 47 participants. I asked them to fill out the inventory of attitudes towards seeking mental health services, which is a survey and a short socio-demographic questionnaire as well. And then for the qualitative phase, because this is a mixed methods project, so we had a quantitative followed by qualitative, we had 20 participants in that one. So out of the initial 47, I invited 20 participants to take part in one-on-one interviews with me. And the discussions were really interesting. So let's move on to the results then. From the quantitative phase, so from those surveys that I did, it was very interesting to see that many of the community members spoke very openly on the survey about mental health issues that they had faced in their lifetime. And it really seemed to be that stress that they faced, worrying and missing their family, and depression were really those top three mental health issues that they faced as a community. It was also interesting to note their sort of patterns of mental health consultation. Now, many of the participants said that they had actually spoken to their family or to their friends about mental health issues that they were facing. And then they also said that they had sought services or mental health care services in Canada as well. And it's very interesting to see that it's about 44%, so almost half of the participants reported seeking mental health care in Canada. Now, to provide a little bit of perspective, for example, CAMH reports, or the Center for Addiction and Mental Health reports that by the age of 40, 1 in 2 Canadians has had a mental illness or a mental health issue. So it's a similar sort of statistic. But the thing is, often within our communities, we think that, we don't have mental illness, or we don't have mental health problems, or people don't seek mental health care. But almost half of the participants here had actually sought mental health care in Canada. And that's a very high number. And within that mental health consultation, it's important to note as well that most had gone to their family doctor, as opposed to going to specialized mental health care. So, for example, they didn't choose to go see a psychiatrist or a psychologist or a counselor, etc. It was sort of their family doctor, who isn't usually all that specialized in mental health care. That's who they decided to speak to. And then when I analyzed some of the results from the survey, the inventory of attitudes towards seeking mental health services that was developed by McKenzie and colleagues. So it seemed that there were 3 particular promoters or facilitators of having a positive attitudes towards seeking mental health services. The first was being employed in one's own field of work or study. So, for example, if the person had trained as an engineer in Bangladesh, they were able to get employment in Canada that was related to that field. So finding meaningful employment is the term that I used for that. The second was actually having male gender. The men in my study, although it was a small number, a small sample size of men. But regardless, it's interesting to note that the men in my study had more positive attitudes towards seeking mental health services than women. And that's interesting just because generally in the literature, what you would find is that generally in the literature, it would be that that it's women who are more likely to seek mental health services and more open or more expressive about talking about their problems or seeking psychological help. So it's very interesting to note and to see that the men in this study actually seem to be more open to this idea of going to seek a professional for mental health issues. And then the last facilitator or promoter that was associated with having more positive attitudes towards seeking mental health services was that of attending school in Canada. So again, sort of, it was also more likely for a man to have sought education or further education in Canada as well. So that was all interrelated, which was very interesting to see. So now we'll move on now to the qualitative phase, and I'll share some findings from there. So as part of the interviews, I showed all the participants these 8 different mental health resources that you can see on your screen. So there are general services, youth services, women's services, and then general mental health services as well. So I put the logo there printed out on a piece of paper and some information about each of these resources. And I asked them, have you ever seen this resource? Have you ever used it? Is it familiar to you? And as you can imagine, for the majority of them, they had very little knowledge of the mental health resources that were available to them here in the city. The vast majority of them only knew 1 or 2 mental health resources out of the 8 that I asked about. And for the vast majority of the participants, the suicide helpline, the blue sort of line or the crisis link that you often see in the TTC subway, that was the only mental health resource that they could readily identify, right? That one, maybe because they were so close to a subway station perhaps as well, and everybody used the subway, but that was the only one that was so well advertised that they knew about. And unfortunately, they didn't have knowledge about the other resources that were available to them. Now, moving on to looking at some of the ideas and the interesting discussion that came out of the interviews. So I conducted thematic analysis on the interview transcripts. And it was very interesting when I looked at the conceptions of mental health and mental illness. Now, they had a very holistic and social determinants of health perspective. So for example, generally in Canada, often we talk about mental health and mental illness in a very biological way, right? We talk about neurotransmitters, disruption in neurotransmitters, etc., right? And we also perhaps talk a lot about the genetic underpinning. So for example, if a person has bipolar disorder running in their family, then it's likely they may have bipolar disorder, etc. But only one of the participants actually out of the 20 that I interviewed spoke about the biological underpinnings or spoke about neurotransmitters related to mental illness. And then very few, I think about 2 or 3, spoke about spiritual causation of mental illness. So talking about, for example, jinn possession or spirit possession. But for the vast majority of them, most people talked about mental health in a very holistic, social determinants of health kind of way, right? They related mental health to, kind of being able to function in a community, working all together, cooperating all together in a society, running smoothly all together, basically functioning in society, which is very interesting. So you can see from this quote from one of the participants. And here too, when I talk to them about mental health stressors that they face on a day-to-day basis, again, it was the very social determinants of health kind of perspective, because they talked about how it's difficult to get a job. So again, those difficulties of economic integration for newcomers and immigrants after coming to Canada. And so this one woman, she talked about how particularly the men kind of spend all day, they go outside, they leave the home, and they spend all day trying to find a job. And they come back, defeated, exhausted, and so angry that they can't find employment, right? Particularly because oftentimes they're so educated and so skilled from back in Bangladesh, and to have to come to Canada and not be able to put those amazing skills to use is so demeaning and so demoralizing. And then for the women, often they're, left in the home in a traditional sort of home setup. The woman stays home, the mother stays home, and she sends her children to school. And she sees, very quickly and very rapidly, they kind of change right before her eyes, right? They start wearing different clothes, their accents change, they want to eat different food, their culture, their values, the way they speak to their parents, it all starts to change very rapidly. And it's very, very isolating for the woman, for the mother who is left at home, who now, when her husband comes home, is dealing with an angry husband who's, demoralized and doesn't have a job. And then children who are basically like aliens to her, right? She doesn't even recognize them anymore. And so this woman, she talked about how depression starts. And then she knew someone in the community that actually committed suicide from all the stress that she was facing, right? That it was so difficult to, that it was so difficult to actually, what can we say, to integrate and to come to this new country and to have basically your whole world turned upside down, right? You lose the social support system that you used to have back in Bangladesh, right? Your family, your friends, you worry about them, you miss them all the time. But then also now that you have this nuclear family, your husband, your children, they too become strangers and you become so isolated from them. That this woman actually felt that she didn't have anywhere to turn, and she ended up taking her own life. And these are sort of those stories of suicide that we don't hear about, right? I'm often absolutely horrified generally about how mental illness is portrayed in the media, right? They only focus on aggression or on violence, right? That's what sells, right? That's the kind of news that they always want to portray. But these stories of suicide, these sort of quiet stories that just happen in the community all the time because of the loneliness and isolation that we all feel, it's so unfortunate because they get buried and silenced and nobody ever hears about them. And then when you talk to the community, you know, do people commit suicide? Are there mental health issues? What's happening in the community? Everybody is completely oblivious to it and completely denies that it happens within the community. And that's so unfortunate because these stories do exist. And, you know, it's so unfortunate that we don't learn from it and we don't take time to think, you know, what is the pain? What is the isolation? What is the loneliness that my neighbor right next to me that I see every day, what might she be facing? What might he be going through? Right? We're so, unfortunately, in our sort of self-absorbed bubbles and the life and the sort of the fast-paced kind of life that we lead here, we often forget to really connect with our neighbors in that way. And so continuing with that as well, let me just say, so taking all of the interview discussions together, I kind of put the different ideas that the community members were talking about into a list of barriers, into a list of promoters or facilitators of mental health service access. So there were certain barriers. So for example, you know, lack of mental health literacy. You know, many Bangladeshi community members felt that they just didn't have information about what mental health resources were available, but even just sort of the knowledge or the language of what mental health is or mental illness, or the fact that immigrants and newcomers face a lot of mental health challenges upon arrival. They just felt like they were in the dark and hadn't been given this information. Mental health stigma within the community was also a big one. You know, many community members, just because the East Danforth community is such a tight-knit sort of community, you know, there are a lot of high-rise buildings. Everyone lives very closely in space together, but they also, everybody kind of knows everybody as well. And so they were very afraid that, you know, if I went to go seek mental health services, if I went to go talk to a psychiatrist or somebody like this, everybody in the community would know. And this was also a major barrier. And then there were a bunch of promoters and facilitators as well. So for example, you know, community members talked about, you know, if they had internet access, they could actually Google and try to find services that were available to them. They talked about how having a community or having social support, people who actually supported you going to seeking mental health services, that was helpful. They talked about also the big importance on, you know, that if there are mental health services being offered, they really need to emphasize how their services are confidential. This was a very big concern for the Bangladeshi community. They were just very afraid that everybody was going to know that they were seeking mental health services, and that was going to ruin their children's chances, for example, of getting married. So they were worried about their children, but then they were also worried, for example, about securing employment, etc. So there were a lot of worries about, you know, if this information leaked out to the community, everybody would know that I'm seeking mental health services, and this would be very horrible for just myself as an individual, but for my family as well. So when I try to put together the findings from the quantitative and the qualitative phase, which is what we do in mixed methods research, it seemed to be that the overarching factor that was kind of related to all those barriers and promoters from both legs of the study, it really seemed to be the relative sort of cultural and social isolation of the Bangladeshi community living there in East Danforth. And a lot of community members spoke about this very openly within the interview discussions. You know, they said how, you know, because we kind of made our own cultural bubble, you could say, you know, that the ideas that we had in Bangladesh about what it is to seek mental health services kind of continued and perpetuated here in Toronto as well, because we're still within our own community. We've created a little Bangladesh for ourselves as well. And so those same ideas keep going. And they talked about, you know, for example, how, you know, back home in Bangladesh, most people have this idea that, you know, if you go to seek mental health services, it's because you've, you know, quote unquote, gone completely crazy, right? You're boggled, right? There, you know, you're locked up, you're sent away. There's this one particular mental health hospital everybody knows about in Pabna. You're sent there, you're locked away, and you know, that's the end of you. That's sort of the idea that people have. But this idea that you could seek mental health care for different mental health issues, such as, loneliness or feeling isolated, and you're doing that in a preventative manner. It's not that it's a last resort, etc. That idea wasn't there. And they talked about how, I don't think, in our generation, and this new generation of immigrants, that idea will change, but maybe it may change for the future generation, for our children. And that's really, it was very interesting to hear the community members speak about it in that way. And so I just want to highlight that, Access Alliance in 2013 put out a report about how bad jobs are making us sick. Now, if I was going to put a similar report together from the Bangladeshi community, it seems like their report might be called something like, bad jobs are not even letting us consider our mental health. Because not only, the Bangladeshi community talked a lot about the difficulties of economic integration, of unemployment, underemployment, a precarious employment as well, and how all of that, everybody is so concerned about putting food on the table, and rightly so, right? Obviously, that is an extreme stressor and an extreme priority for any family, but it gets to the point that they don't even have the opportunity or the mind space or the wherewithal to even think about their own mental health, right? They don't have time to think about, I'm feeling completely isolated. I'm really lonely. I'm feeling depressed because I'm not able to find a job, right? All of those mental health issues and those considering their mental health is just not even a possibility. And so, of course, again, we can criticize and talk about all the barriers and all the difficulties, but let's try to be action-oriented and try to put together a strategy from what all the participants shared from this project. So just to summarize again, and then I'll share the strategy, mental health is a big concern, a major concern for Bangladeshi immigrant populations. But however, the lack of economic support and the difficulties of economic integration make it extremely difficult, if not impossible, for them to prioritize their mental health. And the community lacks information as well as mental health awareness on these very important issues, particularly when it comes to newcomer and immigrant mental health. And if we're going to tackle this problem, it really requires a multimodal, sort of a multi-level action plan, right? Oftentimes we think that mental health is just an issue for the mental health system or for the health system, but that's not true, right? It requires action from the government, from social services, from our education system, as well as the community and at the individual level. And we have to consider that all parts of society kind of need to work together to mitigate this problem. So at the government level, the Bangladeshi community members spoke a lot about how the government needs to take a greater role and needs to step up their support. So offering greater financial support for newcomers and immigrants upon arrival in Canada. There needs to be thoughtful jobs and skills matching programs available for newcomers, right? It doesn't make any sense. For example, the point system in Canada doesn't make any sense if we can't offer that newcomer with a job that is commensurate to their skills and to their assets and to the education that they're bringing into Canada, right? Why insist on having all this education, all these skills, if you're not going to be able to put them to use, right? Wouldn't that, it's absolutely, it totally makes sense that a person would be demoralized and their mental health would go on a downward spiral if they're put in that situation. So we have to, rethink all of this when it comes to programs for newcomers and for immigrants. As well, the Bangladeshi newcomers and immigrant populations really felt that providing that information about mental health resources and programs happening in Canada or in Toronto or in the community, it needs to be provided from the government. They felt that responsibility is on the government to provide that information to immigrants right upon arrival, all right? Because that's when they need it. They don't have time, amid trying to find a job or running home from work or, the multiple jobs they probably have to do to be able to put food on the table for their family. They don't have time to, sit there and try to find mental health resources or even to be considering their mental health. So it needs to be made easier for them. Then also at the health system level, there were a couple of action items as well. So, for example, the development of mental health care models that are grounded in cultural safety, that actually take into consideration Bangladeshi communities' sort of unique perceptions and ideas, right? For example, their sort of holistic or social determinants, sort of social determinants kind of model of mental health care or mental illness. Also, their ideas or their importance on insisting on confidentiality, and those other sorts of sensitivities within the community need to be considered when we're trying to develop mental health care for the community. Some people liked having Bengali translators available within mental health care systems. Others didn't because they felt that it impinged upon confidentiality. So again, that was a very big concern. And they also felt that because doctors are very well respected and looked up to within the Bangladeshi community, they really liked the idea of being able to go to the family physician for mental health care. So if we can provide greater training, mental health specific training for GPs, for family physicians working in that community or living in that neighborhood, it could help with the provision of mental health services. And that's actually also outlined in Canada's mental health strategy as well. That was disseminated by the Mental Health Commission of Canada. So then a third, at the community level, they really thought that the community could have community awareness campaigns and educational programs, whether that was, at the public school, have parenting programs for, parents love their kids. They're very invested in their children's future. If there was sort of mental health workshops or how to foster positive mental health or resilience in their children, those types of workshops that were taking place at the public school, that could be a way to engage parents and to help the community, or to have such community awareness campaigns within the mosque or within the temple, etc. Just have them in spaces where people just normally congregate. And then lastly, people really talked about how one of the most powerful ways that we can sort of try to dismantle mental health stigma is for there to be community champions, basically. And we've seen this in research, and empirically we've seen this as well. Research tells us that one of the best ways to dismantle mental health stigma is for somebody, respected people, leaders in the community, to get up and to be open and to share their experiences with mental health issues they might have faced. Maybe they were diagnosed with a mental illness, or just what their experiences were in trying to seek mental health services in Canada. And having those sorts of community champions or just role models to just come out and say, hey, it's okay, right? Everybody feels lonely or isolated or has a very difficult time after arriving in Canada, right? That's something, and just sort of normalizing that conversation and saying that it's okay to seek services. And as a community, we won't judge you for it, right? Just having that open conversation is just so important and crucial. And so just to tell you there are some more publications from this project as well. There was a blog piece that I published in the Newcomer Mental Health Matters blog from Access Alliance. You can see that one. And then also I was interviewed for the online journal or magazine, The Local, about the mental health crisis in Little Bangladesh. And I'm still currently working on trying to get this particular project published in an academic journal as well. But of course, the challenges of publication and particularly for mixed methods research, because it has both a quantitative and a qualitative phase. The manuscript is so long that it often doesn't meet the word count limitations of a lot of journals. So hopefully that will get done soon as well. I just wanted to put your attention to some events that are happening within the city. If you are interested in this topic, on November 28th, the South Asian Mental Health Conference is going on through the Collaborative for South Asian Mental Health. On the organizing committee for that. If you are at that event, please do come out and say hello. It'd be lovely to connect. And then also, the Canadian Muslim Mental Health Conference is coming up on December 16th as well. So a lot of a great sort of opportunities if you are in research or you're interested in this particular topic. So thank you very much. Jazakumullah khairan. I really appreciate anybody who's tuned in. I look forward to all your questions, and I hope we can also keep in touch afterwards as well. Thank you so much.
Thank you, Dr. Islam, for a very informative presentation. We will move to the question and answer period. So those of you that are with us live, if you would like to continue to send questions in, we will try to address them time permitting. So I'll start with some basic questions, kind of overarching in terms of your research. The first one is, what were some challenges that you faced while you were doing this project? And was the community receptive? And based on that experience, do you have any advice that you can share with aspiring researchers?
Sure. So those are great questions. So the first one, you know what? I was kind of blindsided by some of the challenges that I faced when I started. I had thought, I'm Bangladeshi, I speak Bengali, this should be fine. I should be able to, get into the community and people would understand why this is worthwhile. But I found that there was a lot of, what can we say, suspicion, sort of, why are you here? You don't live here. Why are you doing this project? So it was a very interesting process. And beyond that too, I thought it was interesting that my identity also came into question, where everybody, after speaking to me or after hearing it from me, they said, oh no, you're not Bangladeshi, you're Indian Bengali. So, and I've never been to India. My parents are not from India. My grandparents are. Yes, that's true. But I never considered that as part of my identity until that was the reception I got in the community. So that was a very interesting process. But after a while, after having many conversations with community members, even before I started the research, I kind of just wanted to get the lay of the land, talk to people first. I did find that people were very happy that I was there. I tried to help people, kind of got involved in people's lives, help people with resumes, tried to find jobs for people, because people had all these questions. And again, that lack of economic integration was really first and foremost on their minds. And so trying to help them and trying to give back to the community in that way made them finally understand, oh, okay, no, she's really here to help and she's here for a long term kind of way and really does want to give back. And that's kind of what I need to do to kind of assuage those suspicions, perhaps. And then some advice for aspiring researchers. I think what's really important is to be able to find your niche. Now, if there's papers that you've read or certain professors or researchers that you really admire, you look up to, you really like their projects, read those, get an understanding of what they've done, and then figure out what you're going to add to it. What's the added sort of value that you will bring to academia from what you want to do? Now, there's not a lot of research on Bangladeshis, for example, which is why I want to do it. It's my community. I do very much so believe in researching what you know. And in being a part of the community as well, wanting to always give back to the community in that way. And then also, my PhD was in epidemiology, which is, purely quantitative. But I felt that it was very important to also bring in the qualitative component and to learn about mixed methods research. So I did that on my own. And though that wasn't offered in my program, I took courses from other universities and tried to, beef up my skills in that way, because I found that was really missing in our program. And I didn't want to, just be an epidemiologist. I didn't just want to focus on quantitative. I wanted to be more than that. So that too was sort of a way that I kind of developed my own niche. And that's, I hope, something that can be a useful bit of advice for other aspiring researchers as well.
Thank you. So it sounds like, that whole aspect of building trust perhaps was supportive in accessing the community. I wanted to ask you some more specific questions that are coming in related to the research itself. So you mentioned that from your sample, it was men who surprisingly were more comfortable in speaking and addressing maybe some of the issues related to mental health. Were there any reasons that you could ascribe for this? What contributed to this fact? Because, as you said, typically, even generally in Canadian mental health population, it's usually women that speak more or are open about it.
Okay, that's a great question, and I found that particularly interesting as well. Some of the participants actually touched on that in the interviews. They talked about how, first, women are less likely to be outside the home. Now, it's the men who are usually going out, whether it's they have their jobs or they're attending further schooling or education in Canada, whatever the issue is. Often the mother is the one who is at home. And so she is more isolated and doesn't have, sort of the hasn't developed those skills, maybe the social skills, or isn't as open to being able to go out and seek mental health care, to talk to someone about their mental health issues. They don't feel as open to do that. That's part of it. And then they also talked about how this sort of, the burden or the responsibility of a family's reputation rests more on a woman or on the mother, the woman of the household. And so many of the women felt very inhibited from trying to seek mental health care or to talk about whatever issues or problems they might be facing, because they were afraid of what the ramifications would be for their family. Again, they were afraid that their children wouldn't get married. They were afraid that nobody would talk to them anymore, that they would be blacklisted in the community. And so because of those sort of stressors or that responsibility on the women, that again inhibited them from seeking mental health services. But again, the sample of men in the study was very small, but I think it does warrant further research, and it would be interesting to understand why that was the case.
Right. Yeah. Thank you. Another question we have. Okay, so from what you had presented in your research, some of the mental health conditions that were identified were related to stress, anxiety, depression. We didn't see things, perhaps other mental health conditions such as schizophrenia or bipolar ADHD. I think you had mentioned one person who had clinically, maybe from the family history, but other than that, were they using specific labels, or were you deducing from the qualities of what they were saying they were experiencing that these were the mental health conditions, or is there a reason why perhaps other components of mental health were not labeled?
It's a really great question too. That particular part of the study was from the socio-demographic questionnaire. So I'd just given a list of, have you ever in your lifetime experienced depression or anxiety, or do you worry and miss your family? Within that list, I tried not to use clinical mental illness types of terms. So for example, like schizophrenia or bipolar disorder, I purposefully left that out because I wanted them to sort of, engage in it without too much of those technical terms. But in the interviews, I was looking to see if they would talk about different diagnoses or have knowledge of that. And no, nobody actually mentioned schizophrenia or bipolar disorder or other terms other than depression, which depression, of course, is kind of used more in just a general sort of way in language. It's not even necessarily in reference to clinical depression. And again, I think that might be related to that lack of mental health literacy or mental health awareness as well, that they were talking about, that they don't really know a lot about mental health issues or about mental illness. And so to even have those words in their lexicon, or to know if someone was diagnosed with such a mental illness, they wouldn't really discuss it because of that lack of knowledge.
Thank you. I'm just going to move to the last question. You spoke quite a bit about confidentiality being strong, and stigma strongly being attached to people wanting to share or not wanting to share for that matter. And you talked about the social and cultural isolation factor with that. You addressed the fact that community leaders perhaps can speak up more about it to help address this. And perhaps the future generation can perhaps will be more comfortable. How do you think this can start? I mean, I guess moving forward, how can this be actionable?
That's a really great question too. So I'm trying to work with some community organizations. For example, we have some great Bangladeshi community organizations here in Toronto, and one, for example, is interested in doing sort of a mental health workshop series and having that within the community. So, for example, just booking out the community center and having a free event. That's something that I was in discussion with doing, and there are a lot of youth and young people, young researchers as well. They're just passionate about this, who want to do this for the community. And I was also working on a project with some community members on developing a film project on mental health. Bangladeshis like to watch natoks, which are like the dramas, or I don't know what you would call them, but fun things on TV often. And sometimes they do address more serious topics such as mental illness, but often not necessarily in the most informed way or most sensitive way. And so we were trying to see if we could kind of make our own natok that addressed mental health issues or mental illness within that East Danforth community. So getting actors within the community, developing our own planned storyline. Unfortunately, that project fell through. But I am working with community members to try and develop these kinds of ideas and projects and get them off the ground. And there are amazing people within the community that do care about these issues and are trying the best they can within the community to develop these programs, for the community, by the community. So there's a lot of potential.
Thank you. We'll be looking forward to those. So I will close off just because of time, but certainly I mean, I know we would all love to listen more in terms of your research and recommendations. Thank you for sharing with us. It's definitely been an enriching experience. And it's not only giving us insight into the Bangladeshi community, but also looking at other ways to potentially work with other communities in terms of accessing and trying to understand issues, both in terms of your research methods and findings. So thank you for that. I also wanted to let our viewers know that this is part of a monthly series, once a month on Saturday mornings. We do offer these webinars. Please feel free to also browse our YouTube channel for past webinars as well. Thank you all for participating. Take care.
Thanks so much.
Bye now.